superficial and middle layers of the pelvic floor. So the superficial layers are kind of in green. You can see they're really surrounding the sphincters, and they also help with sexual function as well. And then the middle layer is kind of in yellow. So that's the middle layer that provides support to our internal organs. Doing our deep dive, looking in from the top down, we have our deep layer of the pelvic floor, which is primarily the levator ani muscle. And you can see it's connecting from the coccyx, that bony area in the back, to the front. We can also see that there's kind of a missing part in there. So there's a hole that allows us to have a vaginal delivery, but this also mechanically sets us up for problems down the line if there is issues. So when we think about the role of the pelvic floor, a lot of times we think it's only involved in controlling our bladder and bowel function, but it's also a major component of our core. So when we think about the core, a lot of times we think of our six-pack, we think of our obliques. Those muscles actually help move the trunk. The pelvic floor is really providing stability for everything we do. When we're standing, when we're walking and moving, the pelvic floor is helping to control that. So that's something that sometimes we zoom in and we only think the pelvic floor is everything in the pelvis. It's really providing our support for the entire body for every functional thing we do, whether we're walking, whether we're bending, lifting, carrying objects, which we do a lot when we have a little one. The pelvic floor is going to be playing a role with this. And the pelvic floor doesn't work by itself, even though it is amazing. It works primarily with the diaphragm, our deepest abdominal muscle, the transverse abdominis, and then also our deep back muscles, the multifidi. And so really, these four muscles kind of form, like if you think of a soda can, the top, bottom, and front and back of our trunk support. Thinking about how the pelvic floor works, it kind of mirrors the diaphragm. So when we take a nice deep breath, I'm going to turn this a little bit so I can show you. As we inhale, the diaphragm and the pelvic floor kind of lower down to create space for air to come into the trunk, and then as we exhale, they recoil. So they almost work as a piston, moving up and down when we're breathing and doing many different things. And then when we look at other members that provide support to the body, we have kind of slings that crisscross the body front to back that provide more global muscular support. Unfortunately, even though these groups of muscles that comprise the deep core are very great and have a lot of role in postural control and stability, all of those muscles are the ones that are very greatly impacted during pregnancy. So if we think about how important the core is keeping us upright, walking, moving, doing everything, and then we kind of put them in a position, like if your arm was just stuck like this for 9 months, it would probably be hard to do a lot of the activities you need to do on a daily basis. So then thinking about what is pelvic floor physical therapy, it's kind of a specialization that works with assessing and treating the muscles of the pelvis, but also the abdomen, right? So when we're thinking about that deep core, pelvic floor physical therapists focus on this. And so really what we're trying to do is optimize function, motor control, length and mobility of these structures if there is dysfunction. And you can see we have this big long definition from the special section from the American Physical Therapy Association, all the things that a pelvic health physical therapist might specialize in. When we think about pelvic health physical therapy, I think sometimes I've had patients Googling, what does an exam entail? Everyone gets very nervous about what it actually means. But just like you're going to the doctor to have a check on how the organs of the pelvis are doing, we need to be able to access and assess how those muscles are functioning. And the only way to do that is internally, right? The pelvic floor is inside of us, so we have to go there to check that function. So that's something that kind of can be almost a barrier at times, because if there's a lot of trauma to the area, if there's pain, we don't really want people to access that area. So that can be an issue sometimes. So thinking about the conditions we treat, there's a long list, and this is just like the tip of the iceberg, but a lot of time it can be urinary and fecal incontinence, so having leaking with coughing, sneezing, or activity. It could be you're walking and you're just leaking and you're not sure why. When we think of urge incontinence, that's more having a strong urge to urinate and then leaking as well. This also can include a lot of dysfunction of the pelvis, the spine, and the lower extremity itself, because we know the pelvic floor is a really important component, and then we have attachments of all those surrounding muscle groups. So if there's something going on with those, that can impact the pelvic floor. And there is a really strong correlation between back pain and hip pain and pelvic floor dysfunction. So a lot of people with back pain may have some leaking and be afraid to talk about it because they're embarrassed. And so that can be another barrier. We're going to talk about pregnancy, and really, this is important to notice. There's not going to be a specific outline or protocol that physical therapists are going to follow during this period. As much as I wish I could give you this, it really depends. It's vital that we take each mother's experience and individualize it, because the amount of variability is so high. And then when we think about the ability to do research and create protocols, it's very difficult to study this population because there's a lot of ethical issues and risk that could be involved if we're providing some interventions and not providing them to another group. So thinking about like that highest level of quality, like a randomized control trial, it's not very ethical to do it. And so that creates a lot of nuance where we have so much information all over the place. It can be really confusing during this time. So this slide is very busy, and it's that way on purpose. It's really important to notice that during pregnancy, every system of the body is impacted. And symptoms may vary wildly. Some mothers may have all the negative symptoms like nausea and vomiting, shortness of breath, edema, nerve irritation, and there may be varying levels. So this is really important to consider, that the normal changes that happen to the body can be widely variable across the population. And then we could spend an entire day talking about the role of hormones, but it's really important to know there's changes in the soft tissue that's going to affect every part of the body, but there's also changes in cognition, alertness, and focus that can be difficult to deal with as well. Looking a little bit closer at those urogenital changes, we can see there's a direct impact on how the bladder works, its capacity, so that's going to have some implications for difficulty with emptying. And then we can see that there's a huge incidence of stress urinary incontinence during pregnancy. The changes where the pelvis is no longer housing the uterus, it's growing outside, then has implications for what's going on in the abdomen as well. When we think about the skeletal changes in pregnancy, we know the rib cage is impacted, but there's a lot of changes that also happen at the pelvis. So when we think about that initial picture where we have this very stable ring and so much connective tissue keeping it together, guess what? During pregnancy, those ligaments kind of go on a little break. And so, again, we're taking the foundation of our core and altering that. So again, that can create some problems, especially to the pelvic floor. Additionally, based on the changes that's happening as the baby's growing and we're getting more downward pressure on that structure. And then as we move up to the abdomen, we have a normal occurrence of that diastasis recti abdominis. So this is something, again, it's really great. It's getting more attention, but there's a lot of confusion around this. This is a perfectly normal thing that happens with the body to accommodate the growing baby. So there's 100% incidence at 35 weeks. I mean, if you've talked to a mother at 35 weeks, it's probably going to be an interesting time for them. And so when we think about this, there's really an importance to kind of stay on top of what's going on with this separation. Sometimes we focus on how far the tissue is separated, but we also want to see how is the mother managing pressure. So with this, when we're talking about exercise or even like daily activities, like if you have a 4-year-old and you're picking up your child that's a little heavy, we might begin to notice some coning occurring. And so that's a sign that we're not having good pressure management. And so we know that tissue is vulnerable, and if we continue to irritate it, this can predispose us to hernias or other issues. And so again, the more we can be aware of these conditions and kind of modify our activity to make sure we're not getting these vulnerable structures continually impacted, that's going to set us up for success in the postpartum world. So looking at our postural changes, we can see the hormones are going to affect those connective structures. And so a lot of times, the body is just trying to keep doing what it does, right? Women are really great at just pushing through no matter what. And so what we're doing, if we have to do some things that are a little more difficult, we start to find postures that give us a little more feedback. So we have decreased input from kind of the core and the ligaments, which kind of tell our body where it is in space. And so a lot of times you'll see women are kind of leaning back. They're trying to get bony end feel to say where they are in space and use their skeleton to be able to hold them up instead of relying on those global muscles to help do the role of the postural muscles that are no longer able to complete that. Another thing that's really important, we notice, and this also occurs postpartum, we get this lateral shift of kind of holding. I liked, back when there were malls, I guess, this used to be like the teenage mall girl stance, like shifting to the side. Okay, so a lot of times the body is just trying to find ways to decrease energy costs and find a way to get support. And so that may be developing really bad habits that can lead to hip pain or can lead to back pain because we're really leaning back. So we can see in our little pregnant lady here that posterior translation and getting that increased curve of the lumbar spine can really create a lot of issues later on. And so really, we're trying to think about leaning forward and stacking the rib cage over the pelvis, as you can see in the correct posture. So we're maintaining good alignment and using more muscular support instead of stressing those connective structures. So with everything we just learned, this shouldn't be surprising. And you can see there's a really high incidence. Again, some of these studies are a little bit older, but the amount of time it takes to collect this data is pretty difficult. And so I think it's really important to notice that when there's a risk for increased back pain, that can increase the risk for depression during pregnancy and also increase risk for postpartum depression. So a lot of this is treatable, and for some reason, we don't always know what to do. We think it's just normal. A lot of times I've heard, well, pregnancy is painful and that's just how it is. And that's not true. So this is something that hopefully will be a little bit of a shock value. Again, I feel like it's easy to see why physical therapy could be indicated for this. Okay, so during pregnancy, there's so many things that pelvic health physical therapy can do. So we've kind of talked about addressing pain, dealing with things like swelling and some of the not so great symptoms like incontinence and leaking. But it's also important to know as these changes are occurring, you might feel great. And that's also still a reason to maybe go to physical therapy. We really want to optimize posture, give you guidance how to modify exercise. I know for myself, exercise was like a huge mental health booster for me. And even though I have a lot of knowledge as a pelvic health physical therapist, I had terrible pelvic girdle pain and I could not do a lot of different things. So again, I myself went to physical therapy because I really needed some guidance, and it was just kind of a whole new mind shift. And we'll talk about this a little later about like, wow, just because you have the information, it doesn't mean you know what to do with it. So information is one thing, but like the application and experience with that information is a completely other thing. When we talk about birth preparation, I'm gonna get on my little soapbox here. I really like to point out this is helpful to give you some different ideas. What this would entail in physical therapy is working on different ways to open the inlet and outlet of the pelvis. So this can be strategies that can be implemented during labor if you're having like a failure to progress. You just had a lecture about the role of doulas, and a lot of physical therapists will also go through doula training so they can participate in the labor and delivery process and be that sort of support. We also think about giving some of that tissue some work, so doing some perineal stretching can help decrease the risk of tearing and get those tissues ready to go on the journey they're going to go to. what I want to be very, very clear about is that birth preparation is not like a boot camp that you need to do. And like, if you do this, you're going to push twice or you're going to avoid things. There's a lot of things that you can do to kind of optimize. But really, the birth process is its own adventure. And so we need to kind of help support mothers and let them know, hey, this could be very helpful for you. But if something happens and you wind up having a cesarean delivery, that's okay too. And there's nothing you did or did not do that could have changed this. So it's really about almost supporting them and helping them release some of that control that's attached to the kind of birth they want to have. Because this is a huge point postpartum where women are kind of like disappointed and almost feel like a failure if they don't have like 3 pushes and everything's great and then they were like running a marathon the next day. Like that is so unrealistic, it's crazy. But again, it's kind of thrown at us through social media with a lot of misinformation. So your body knows what to do. Like when we were on the Oregon Trail, yes, there was a lot of things like cholera, right? That's, if anyone ever played that game, most people died of cholera, but women were, on the trail, like not knowing about this and having babies without doing any sort of birth prep. So I think it can be helpful, but it is not guaranteeing any specific outcome, and we need to help reinforce that. Okay. So obviously exercise can be super helpful during pregnancy as a form of like stress release, and then we know it can decrease some complications. That's really important. And so this is kind of where the pendulum has swung a little bit too crazy, in my humble opinion, where at first we were really scared to do anything, and then we think we're invincible. And I know the Olympics was great. We had a lot of like women doing and competing, but I think we have to really examine what were the activities they were doing, right? Like, we weren't seeing any pregnant rugby players. I would say that's like a very, not something you should do, right? Anything with trauma, like, don't do it, okay? Like, archery is great. It's probably, challenging in its own way, but it's not kind of on the excessive type. So I think this is another thing where having someone to support women and help guide them into what is appropriate and what's not appropriate can be helpful. And I know there's like a huge push to maintain your identity, right? Just because you're pregnant doesn't mean you have to stop doing things, but it is a time to kind of take a step back and think about, is it worth doing this? Not just can I do it, because maybe you can do it and not have any symptoms, but should you do it? And so there's a lot of nuance here for a reason. We kind of talked about the research, but I think this is a huge area where we kind of have too much information thrown at us, and we need specific guidance in this area. Okay, so when we think about kind of barriers to exercise, there's still a lot of nuance, right? And then depending on how you're feeling, if someone's having like terrible nausea and vomiting, is it like beneficial to their body and the growth of the baby to like go out and try to go for a run? Maybe not, right? So thinking about how are we doing with nutrition? How are we doing with sleep? How are we doing balancing work and maybe caring for other children? And does exercise make sense? And the other thing I want to point out is like exercise and activity are kind of interchangeable, right? So exercise doesn't have to be a CrossFit class. It can be just working on some diaphragmatic breathing and mobility, and that might be enough to keep a woman interested and satisfy those maybe mental health needs. She needs to feel like herself. But I think it's really important to think about that. The other thing we can think about is lack of access to equipment. So we just had kind of like a little bit of a wildfire season. If walking feels good and our only space to do that is outside, that can be really difficult. If it's winter and there's ice everywhere and there's a risk for fall, that can also be difficult. So there's a lot of barriers, even though we're kind of yay exercise, which I'm all for it. I think we need to kind of devise a little more individualized care with this and help create some guidance. So what I really like to focus on is, even though we have all this research, when you're speaking and working with your mothers N equals 1, right? You could talk to 6 different women. They could have 6 different experiences. So we need to be very sensitive to that. We also need to consider like what they were doing before. So sometimes it's pulling in the reins. Sometimes it's encouraging them like, hey, let's go for a walk, or you can do this. So we kind of have to find that balance. And then really stressing, just because you can doesn't mean you should. I think it's also a huge component where we can help facilitate and just manage symptoms and give a little bit of better information. Okay, so we're gonna do a fun little exercise just to shake things up a little bit. I want everyone to like scoot your chairs back. Okay, and then you're gonna kick one leg out straight. And then I want you to try to hold your leg off the ground and stand up without using your arms. See how it goes. No, you can sit back down after it's done. Okay. How did that go for everyone, right? Some people, it might have been easy. Everything felt great. I've done it before. I can do it again. Some people, that might have been really hard. So this is kind of like my attempt at like, this is postpartum, right? All of a sudden, you get a challenge thrown at you you didn't even know. And so I think this is, while the best I could do, something to think about in the postpartum period. There's a lot of variability. It can feel like a challenge, like, oh my goodness, this is crazy. And so we're kind of shifting gears to kind of help almost, I would say, 98% of the time, pull the reins in and really highlight the extreme need for recovery and support during this period as well. So looking at the anatomic and physiologic changes in postpartum, lots of things are happening again. Again, every system of the body is affected, and really what you see highlighted, and I hope you understand, is that it is way longer than we think it is, right? We're gonna talk about 6 weeks. That's gonna be my next soapbox adventure. But you can see all of these processes are a lot longer than we think. And then thinking about whether you're breastfeeding or not, that can prolong and give you some interesting symptoms a little bit longer. When we think about kind of challenges, especially for the pelvic floor, constipation. Many women complain that their first bowel movement postpartum is worse than their delivery. Okay, so we're putting a lot of pressure and stress to an area that's already been stressed. And we're gonna talk about this. Just because you've had a cesarean delivery doesn't mean the pelvic floor is like good to go and fine, right? There's a lot of changes that occur still. So when we think about this, constipation can set us up for more pelvic floor weakness because we're stressing an area that's already stressed. And then it can also create some pelvic organ prolapse, all right? When we think about the changing and kind of as the uterus shrinks, those ligaments are still having a good time being nice and long. And so if we create increased stress during that time, that can affect those ligaments as well and create problems down the road. And then obviously problems with urination, there can be some things if there was anesthesia, if you had to have a catheter for a little bit. Really, when we think about how the bladder functions, it's kind of changing its capacity. And so it's not so good at feeling when it's full, and that can cause problems with urinating as well. When we think about the cesarean delivery recovery, there's actually the same changes in our pelvic floor and those organs as if you had a vaginal delivery, okay? And thinking about how the cesarean delivery happened, maybe you were pushing for a bit, okay? So maybe you get a double duty, okay? There's a lot of things that I think we need to focus on, especially with the cesarean delivery. With the incision, we're having abdominal surgery. We are cutting through 4 layers of muscle, right? So all these tissues that were stretched to the max and not really efficient at doing their job are then sliced open. So again, when we're like, oh, I just had a little C-section, or I'm just gonna schedule C-section, it's no big deal, and then I'm gonna go on vacation, like, yeah, that's not gonna happen. You're gonna have a lot of things that we need to do by having this. And again, I repeat, cesarean delivery, even if it's planned and scheduled, does not mean the pelvic floor is like good to go, okay? And really, this is a huge part that I wish we could have everywhere. I think having rural healthcare is really difficult because we don't necessarily have all the resources we should. Having physical therapy in the hospital before you go home, learning how to get out of bed. Really, when we're told, okay, you need to protect your incision, don't lift 10 pounds. If your baby was 9 pounds and your car seat is 15 pounds, I'm not a mathematician, but that's over 10 pounds. So how are you going to take care of a baby, recover yourself? Okay, lots of difficulty. And again, I know there's benefits to being home and being out of the hospital, but not providing some of that care is really detrimental to our mothers. And then we're really setting them up for concerns. Why do I have pain? Why does this hurt? I thought everything was going to be fine. So really helping to give them the information. This is major abdominal surgery. This is not like it's just a little delivery. That's not true. It's major surgery, and it requires that much grace and healing time for full recovery. When we look at diastasis recti abdominis in the postpartum world, we can see the longer we have this prevalence, that can create other problems like back pain, which makes sense, right? We have those muscles that are providing support from the front. If they're not fully articulating and working, like if there's a hole in your muscle, that can be an issue, right? If all of a sudden we just took out a piece of your quadricep, it might be a little tough to walk, right? And so when we think about this, we can be even more susceptible to herniation and pain in the postpartum world because we don't have that kind of backing of tissue density, whether it be the placenta behind that, right? So during pregnancy, our belly is nice and hard, and the space that's occupied in our trunk is giving us a little bit of stability and support. Now we take that away, and it's kind of like the wacky, wavy, inflatable arm flailing guy, right? It's just going all over. So if we're coughing, if we're lifting, if we're increasing that intra-abdominal pressure, we don't have that support. It's going to go through the weakest link and can lead to herniation. When we look at the prevalence of symptoms postpartum, there's a lot. And again, I think this is really difficult for women to navigate because there's so many changes and there's so much focus on caring for the baby. We just accept like it's fine, we can push through it, and we have to do anything we can to care for the baby without realizing we need to also care for ourselves. So really, as we increase these symptoms, our risk for postpartum depression goes up, and that makes sense, right? When you're dealing with back pain, when it hurts to get out of bed, and then you're exhausted and you have to take care of a baby, that's gonna easily make you feel really upset and just conflicted when we're getting broadcasted all over social media, just me and my baby, everything's great, right? So if you feel differently, you might feel like you're doing something wrong. And so this is something we need to reinforce and give support to our mothers with. And then when we're looking at kind of self-reported symptoms, we can kind of see we're getting not only symptoms in the pelvic area and the abdomen, but then we can also have shoulder pain and neck pain from a lot of carrying, breastfeeding positions or even bottle feeding positions, right, are going to impact how the body is moving. And so that can be an issue where we're kind of pushing through it. We're having pain down below, we're having pain up above, and that continuation of pain is going to, again, contribute to those mental health challenges. Incontinence. This is a really big one. And again, I have had so many women just say, I had a baby, this is my life now. So in the beginning, yes, it is normal to have some incontinence, okay? That can be very, very normal and part of the healing, but this is something we can address. As we persist past that 6 to 3 month period, 6 week to 3 month period, the incidence can increase, and if you have symptoms at that point, they're probably gonna persist for longer. And then this is really the chance where we're busy, we don't have time for ourselves, and then 10 years down the line, we're still having leaking, and we're thinking that's okay, and this is our life. Really, the risk factors for urinary incontinence increase postpartum if we have urinary incontinence in pregnancy. So when everyone says, in pregnancy, it's just fine, you just pee your pants, it's okay. That's not okay. We can do something about it, and if you have that, you might have leaking postpartum, okay? And that's gonna set you up for a lot of difficult things. When we think about kind of getting back to normal, if you used to go to an exercise class or had a group of friends, if you're thinking about, am I going to pee my pants with walking or stepping off a curb, that's going to really limit to what you want to do. You're not going to want to leave the house. You're not going to want to do the things you used to do because it's a really embarrassing, impactful thing that can be happening. So pelvic health physical therapy postpartum. We talked about a lot of things in general if there is pain. However, I think overall it makes sense that everyone should have physical therapy, right? When we think about an ACL repair, we have a very extensive protocols and timeline, and that is for the repair of one ligament in the knee, right? When we're talking about the core, that is our entire network of postural control, balance. Every functional thing you do, you cannot not use your core muscles. And so to just be like, oh, I just had a baby, it's cool, I'll just figure it out. It's just a really, it's just not the way we should do this. And I think we're getting better at this, but it's still a huge problem. And for myself personally, I know in school and when I did more training in this area, it was okay, cool. If they have pain, you'll see them. Then you can see them, maybe at 6 weeks, maybe just a couple times. But really, what I've learned through my own personal experiences and just working as a clinician, this initial period, so day 0 to 12 weeks, is really a crucial time where we can do a lot of damage if we try to just rush back into activity. So, this is something I've heard so many times, right? We just talked about, I don't think there was one slide where it was 6 weeks, everything's good, green light, right? At 6 weeks, we don't have full tissue healing. So again, I think there's a huge push to return to feeling normal, right? If you had a pregnancy where you were really sick and uncomfortable and couldn't do the things you love, a lot of times you're it's over, now I can get back to being normal. But I think unfortunately, normal and how things were before you were pregnant, it's gonna be shifted. Your body's not gonna be exactly the same. There's some changes that happen, right? When we stretch a rope, it stays lengthened, and that is how the body works, unfortunately, even with extensive healing. So I think we have to give a big X to this. 6 weeks is definitely not enough time, but it still seems to be the standard of care. And then when we think about medical follow-up sometime, we are seen at 2 weeks postpartum and 6 weeks, and then that's it, unless something's going on. So that's a huge disparity in education of what your body can feel like and what is normal during this time. But 6 weeks is not the green light to just jump back into CrossFit. I don't care if you've seen 20 people on Instagram. I think that's very irresponsible for your body, and you'll probably be coming to see me later down the line when you have a hernia or something crazy because you were doing that. So giving women something to do and something to expect so they can feel normal and feel like they're doing something can be really helpful to kind of calm that need to get back to normal. And I think, again, having someone who's seeing them multiple times more frequently can help bridge that gap between what I'm seeing, how I'm feeling, and what I should be doing. So I created this timeline for recovery, and one of the things that you're going to have available to you is something I created called Grit Mama, and it's an 8-week kind of informational handout about things that are perfectly safe to do, and you can choose to do them after delivery. So we'll kind of talk about that, but I really like to use this because it is a continuum, right? How long will it take? It depends. Maybe you had minimal trauma, everything went well, great. Maybe you had a cesarean delivery. Maybe you had a lot of birth trauma, a lot of tearing, okay? There's many things that can happen, but no matter what, we can't speed up physiology. It takes 3 months or 12 weeks for complete tissue healing. So that's super important, right? So when we think about the rehab process, when an ACL rehab occurs, there are certain benchmarks between tissue healing and return to activity that we follow. We don't 100% have this in pregnancy and postpartum, again, because there's so much nuance. nuance. But again, this is a little roadmap, I think, to help show you what's happening. We need to respect the body and tissue healing. So things like getting enough sleep, getting nutrition, having both like emotional and physical support to take off some of the load of doing the dishes and the laundry and caring for children and other activities, going to work, doing all the things can help give you a little bit of a boost, but there's no way we can cheat physiology. And when we think about sleep, at 6 weeks, how many moms do you know that are getting like 7 hours of sleep a night? Everything's great. They're eating 3 square meals a day. It's not happening. So what I do kind of in my little side business of coaching is I really try to educate women, like unless you are meeting X, Y, and Z, when we're thinking about weight loss because you want to get your body back, when you're thinking about jumping into the sport you like to do, we have to be respectful of that. And so when we think about these barriers to exercise postpartum, we kind of have similar things to think about. We know that it's good. We know thinking about exercise as maybe doing deep breathing, maybe going for a walk. That's exercise. Maybe it's lifting our child from the floor into their bassinet because they weigh 10 pounds. That's a pretty good thing to do, okay? This is something that we need to give our mothers a lot more education on. And then thinking about kind of like the physical and mental side. If you feel like, wow, I'm 6 weeks out and I still feel like I've been run over by a truck, that can really make you feel like you're doing something wrong or you're not doing enough or you need to do more. And part of that navigation of this period is saying, hey, or maybe you need to rest more because you're not recovering. Because exercise for you is actually doing a bunch of laundry, caring for your baby, breastfeeding for $7,000 a day, right? Like that's a full-time job. They've had many memes on social media, right? If women were paid for the time they were breastfeeding, we'd all be millionaires. So again, I think there's so many considerations, and just having someone to tell them and give them that support is helpful and will kind of stick with them. So we've kind of talked about how great physical therapy is, but again, huge barriers, especially in this rural area. So for myself, as a physical therapist, when I was working with a bigger company in Butte, I had an 8-week waiting list. So you're dealing with pain. It's really limiting your functional activities, your ability to care for your child, and you call and you get told there's 8 weeks before I can see you. Like, that is crazy. That's going to really make you feel kind of hopeless. Like, there's help and I can get this, but how do I do this? Okay, when we think about the cost of insurance, a lot of times people have crazy copays. You can have the greatest insurance, but if you have a $50 copay every time you come in, $50 is a good amount of diapers. So again, the financial limitations can be very limiting as who is able to provide and see care. And then we think about geographic location. So having to travel. Not everyone, if you're back at work, can drive an hour to go see a physical therapist. I drove an hour to see a physical therapist, but then I commuted an hour for my job. And so I was lucky that I was there and I could put myself on the schedule. But a lot of times that's not available. And sometimes people are driving 2 hours plus, depending on what's going on. And then thinking about the lack of childcare, right? It can be really difficult if you have, multiple children to find time to hire someone to watch them or find a family member and then drive, have an appointment, drive home, right? That's going to be another financial stress. So really with this, from my own experiences and as a clinician, I would say more frequently can be better, but it's very hard. So how do we do this? So I created Grit Mama because I was really this is wild. It just really blew my mind that this could be such an area of need. And there's so much information. Some people will be give me $300 and we'll do box jumps in 6 weeks. Unless I was physically there assessing you, while you were doing stuff, I would say no way. But this is the best we can do kind of in this digital age. And so what I wanted to do is say, hey, if I have an 8-week waiting list, that's really terrible. But what can we do in the meantime? I'm going to hopefully see you beforehand and give you this information. But what's really important in this time is not doing box jump. It's like, how can you go to the bathroom and decrease your risk of straining to not put more stress on that? So it includes a toileting setup, things like how to get out of bed, which is really important. Things like breastfeeding postures, right? A lot of times we get this position because we're like, this is crazy, look at this little thing. But doing this, 700 hours a day, like we talked about, is really gonna do a number on your neck. And then things like lifting and carrying the car seat. I really challenge someone, if you're able to, figure out how to make a car seat safe and lighter. Geez Louise, there's so many. This is where it's like, okay, you better be able to lift 45 pounds right after birth because that's how much everything weighs. Okay, getting up and down from the floor. So again, it's not just exercise. It's like living your life, carrying your baby. How do you do all these things? And then really step-by-step progressions for core and pelvic girdle health. Like I said, we're not there, but you almost have to earn the right to graduate to certain levels, right? So show me you can activate your pelvic floor and work together with your diaphragm and your lower deep abdominal muscles. And then I'll say, hey, okay, maybe you can do this. So this has a lot of information. Of course, I'd love to be able to spend more individual time, but it's something. And so I feel like that can be a helpful thing. So we made it. It's been a long journey. Hopefully you guys enjoyed it. I really hope we've kind of highlighted the pelvic floor. It's not just like this thing that's inside us and we do Kegels and it's great. It is like our entire core and center of stability for our body. When we think about the pregnancy and postpartum period, the body goes on a wild journey, which can be kind of like the Aladdin song, a little bit of column A, a little bit of column B, right? Who knows? It could be different every pregnancy, so we need to respect those changes. And then pelvic floor physical therapy should be a must. It should be the standard of care. And so we're going to try to keep working to help that become more available. So I know myself, I'm now at a private practice in Dillon, and I'm really working to see how can I better be available. So if that's utilizing some telehealth, because I think at 2 weeks, you went to the doctor, and then you're like, there were 17 checklists, and my baby was crying, and I don't know what was going on, so maybe you forgot something. So just to call and say, hey, how's it going? How's it going on the toilet? That's something that with my patients, we talk about all the time and we're comfortable with, and we need to normalize that. I'm leaking, it doesn't feel great. Okay, let's do some things. Here's some things you can start. So I'm really trying to revamp and get creative at the traditional healthcare system and how we can create better access virtually so that you don't have to drive an hour. Obviously, in-person assessment is helpful, but just having the support and steps to point you in the right direction can still have an impact. All right, that was a lot of information. I'll open it to questions if anyone has questions.